People make decisions all the time. Many are simple and many involve multiple choices with multiple possible outcomes. Even though we're used to making decisions, deciding on medical tests and treatments are some of the most stressful decisions we'll have to make. But they're usually no more complex than other decisions, providing we get the right information. And the good thing is, your doctor will share the decision making with you.
Now, Renee, how can I help you today?
So I'm on the pill right now, and I'm just wondering about my different options for contraception.
Okay, so that's a good question.
Ask more and share more in order to know more.
A friend of mine at work was recently diagnosed with prostate cancer, and he's a year or two younger than me, and I believe there's screening that can be done.
Yes.
What are the options around screening?
There's two main tests. I've got to check your prostate with my finger to check the size of it, to see if it's enlarged. And then there's the PSA test, which is the prostate-specific antigen, which is produced by your prostate, and that may give an indication of prostate cancer.
Asking the right questions means you will receive care that better meets your needs.
Well, and they've all got pros and cons, advantages and disadvantages, so it's a matter of working out what's going to be the best sort of contraception for you.
Making good decisions is a combination of your health professional's expert knowledge of medicine and your individual lifestyle, preferences and needs. So it's really important for you and your doctor to make the decision together.
So we've seen Charlotte. She's got a middle ear infection. It's not terrible, but it's moderately bad, and so that's probably why she's been crying at night and had that temperature.
Yeah, okay.
We've got to decide whether she needs antibiotics or not.
The more information you share about you, the easier it will be for your health professional to give you the information you need.
Have you got any trouble with your wee?
No.
Do you have any trouble starting or stopping?
No.
Doing your urine? No dribbling at the end?
No.
And
No, I haven't noticed any change.
Okay. Not getting up at night many times? More?
No.
How many
once,
times? Once.
At most.
Okay. And has anyone in the family got prostate cancer?
Not that I'm aware of.
This means that the decision will take into account your medical history, your individual risk factors, and your lifestyle preferences. The more a part of the decision you are, the more likely you are to succeed in getting the benefits of that treatment.
So that's a good question, because obviously there are lots of different options for contraception. So it's obviously important to know what the different effectiveness rate is of the different methods of contraception. There is a lot of information, and obviously we can give you written information as well to take home.
If, for example, you're deciding on which contraceptive method to use, your choice will be influenced by a range of factors, including any medical conditions you may have and any plans to have children in the future. So making the right treatment choice means understanding your treatment options and sharing the decision-making with your doctor about which option best suits you.
That pill every day. So there's other methods that we call long-acting reversible methods, so things like the contraceptive injection, contraceptive implant, and then there's IUDs as well. I've got a couple here we can have a look at. There's also things like barriers. We talk about condoms, and there's also diaphragms as well.
To make an informed decision about which treatment option is right for you, ask your doctor these 3 questions. What are my treatment options? And one of these options will always be to wait and watch.
So can you tell me what my options are for treatment?
So we can wait and watch, because she's not seriously ill at the moment,
Yeah.
and so it's quite safe to do that.
Yeah.
And probably see her in the next day or so
Right.
if she gets any worse. We can use antibiotics if it looks like a bacterial infection. However, looking at an eardrum, you can't always be sure whether it's bacterial or not. And generally speaking, if it doesn't look bright red and ready to burst, then you'd probably hold off.
What are the possible benefits and harms of those options?
Can you tell me what the possible benefits and harms of each of those options are?
If we just wait and see and just treat her symptomatically, then we can just watch her to see if she gets worse, and she'll probably get better in 80% of the cases. If we give her antibiotics, then we can shorten the duration of her illness, but you have to treat basically 20 children to shorten length of illness in one child. For every 20 children treated with antibiotics, one will get diarrhoea.
Right.
Which is not a serious thing, but it can can be bad at times. You can get rare allergic reactions, especially to the penicillin.
Is there anything else that I can give her?
You can give her something like ibuprofen or Panadol or both. So you can alternate between the two because earaches are painful. Also, at night time, an antihistamine might help to unblock her eustachian tubes and decrease the pressure there and therefore ease the pain. The evidence for prostate screening is still very grey. It's 1 in 1,000 chance of saving someone's life at the age of 60, and it's actually less than that in the age of 50 or your age.
What are the possible benefits and harms of these options?
Well, firstly, the tests aren't 100% accurate, so you can still have a prostate cancer with a negative test. Secondly, if you have a positive test, you may choose to undergo biopsy. Now, that involves sticking a needle several times into your prostate through your rectum, which can be quite painful. One of the risks transferring bugs from your rectum into your prostate and causing infection, and that can be quite a nasty thing.
How likely are each of those benefits and harms to occur to me?
The potential benefits at your age are very unlikely to occur because you're in such a low risk group. You haven't got a family history of prostate cancer and you haven't got any real symptoms.
And how likely are each of those benefits and harms to happen to me?
So it's important for me to find out more about you. I know that you're not a smoker and you're not overweight, and we found out that you haven't got a family history of blood clots. So your risk of blood clots if you were to use the pill is very low. It's the same as the background risk for all the women who are taking the pill, and it would be something of the order of 6 or 7 women out of every 10,000 women in a year would experience a blood clot.
Right. And how about for the implant?
Now the contraceptive implant, so that's the implant that sits under the skin. Again, look, there's a small risk of infection when we put in the implant, and there can be some side effects that women can experience with the implant as well. There's a chance that you can have an unpredictable bleeding pattern because of the implant, and we can't predict what's going to happen to you, but what I can say is something like 1 in 5 women who have an implant will actually have no bleeding at all for the whole time that the implant's in. That's up to 3 years. About 40% of women, that's 2 in every 5 women, will have something like a regular bleed every 3 to 5 weeks. Leaves another 1 in 5 who have some unpredictable bleeding, and then that leaves another percentage, that's another 20% or 1 in 5 women who can have what we describe as sometimes troublesome bleeding or prolonged bleeding, heavy bleeding, but of course that's 1 in 5 women, whereas 4 out of every 5 women will actually have an acceptable bleeding pattern.
Once your health professional has answered these questions, it's important to think about how those answers weigh up for you. Is there an option that fits with your lifestyle, preferences and needs best? You are the best judge of whether you'll take a tablet every day. So if you won't, it's best to tell your doctor at the time so you can discuss other options.
So Renee, you've got a lot of information now about the
Yeah.
different contraceptive methods. Have you had a chance to think about which one you think would be suitable for you?
Yeah, well, based on what I've heard, I do like the idea of the IUD for not having to take a pill every day. I'm also in a long-term relationship, so STI risk is not a concern for me. I guess I'm just a little bit nervous about the procedure, but yeah, it sounds like a really good option.
I know that you haven't had children yet, but
Yeah.
again, it's a reversible method of contraception. It doesn't have any effects on long-term on your fertility. Also, that can be a very convenient factor for the IUD.
Once you have the information from your doctor and have considered how you feel about the options, you can make the decision that is right for you. Ask more and share more in order to know more.